Assalamu alaikum. Today we'll try to know a basic difference among beta blocker, cardioselective calcium channel blockers, and funny current channel blockers. So all of these drugs can reduce the heart rate, but there is a basic difference between beta blocker and cardioselective calcium channel blockers and the funny current channel blockers. Here, the beta blocker such as atenolol, metoprolol, bisoprolol, and cardioselective calcium channel blockers such as verapamil, diltiazem, both of them can reduce the heart rate as well as the cardiac contractility. That's why the beta blocker and cardioselective calcium channel blocker can also act as an antihypertensive drugs. But on the other hand, if you want to just reduce or control the heart rate, but you are not trying to affect the cardiac contractility, that means the ejection fraction or cardiac output, then the best option is to choose the ivabradine, because these drugs only blocks the funny current channel, which is actually sodium channel located at the sinoatrial nodes. That's why the drug only reduces the cardiac impulse rate, but it doesn't block the calcium channel or beta-1 receptors of cardiomyocyte. That's why there is no effect of ivabradine on cardiac contractility. So, in summary, the beta blocker and cardioselective calcium channel blocker, these drugs can reduce the heart rate as well as the cardiac contractility. But on the other hand, the ivabradine only reduces the heart rate without affecting the cardiac contractility. So what is the importance of this information? Suppose a patient presented to you with the complaints of chronic heart failure, but the patient's ejection fraction is less than 35%. So you cannot prescribe a drug which can reduce the ejection fraction further. So you can choose the ivabradine in that case. So what is the indication of ivabradine? Chronic heart failure having the ejection fraction less than 35%. Moreover, you can also prescribe ivabradine if a patient has chronic stable angina but he or she cannot tolerate beta blocker, such as maybe he or she is a patient of bronchial asthma. In that case, you can also prescribe ivabradine. But you must know that before prescribing ivabradine, you have to ensure that he or she is on sinus rhythm and his or her resting heart rate is more or equal 70 beats per minute. In that situation, you can easily prescribe ivabradine.